Question 1. A patient on hemodialysis reports sudden shortness of breath and a feeling of impending doom during treatment. Upon assessment, the technician notes frothy, pink-tinged sputum and crackles heard upon auscultation. Which respiratory condition is most likely occurring? A. Asthma exacerbation. B. Pneumothorax. C. Acute pulmonary edema. D. Bronchitis. Answer: C. Acute pulmonary edema. This question tests recognition of acute respiratory distress, specifically acute pulmonary edema, which is common in hemodialysis patients due to fluid overload. The key clues are sudden shortness of breath, frothy, pink-tinged sputum, and crackles, rales, in the lungs, all classic signs of fluid accumulation in the alveoli. In this situation, the heart cannot pump fluid effectively, leading to fluid backing up into the lungs. For example, if a patient gains too much fluid between dialysis treatments, their lungs can fill with fluid, making it very hard to breathe. Always remember that frothy, pink sputum is a strong indicator of fluid in the lungs, requiring immediate medical attention. Question 2. Which intervention is most appropriate for a dialysis patient experiencing mild dyspnea and hypoxemia, low blood oxygen levels? A. Administering a bronchodilator. B. Placing the patient in a supine position. C. Elevating the head of the bed. D. Performing chest physiotherapy. Answer: C. Elevating the head of the bed. This question focuses on basic interventions for respiratory distress. Elevating the head of the bed helps improve lung expansion and reduces the effort required for breathing by allowing gravity to pull the diaphragm down. While other options might be relevant for different conditions, bronchodilators require a physician's order and specific respiratory assessment. Lying supine would worsen dyspnea, and chest physiotherapy is for mobilizing secretions, not primarily for immediate relief of mild dyspnea from hypoxemia. For example, a patient struggling to breathe will find it much easier sitting upright than lying flat. Always think about how positioning can mechanically assist breathing when a patient is short of breath. Question 3. What is the primary function of the alveoli in the respiratory system? A. To warm and filter inhaled air. B. To produce mucus for airway protection. C. To facilitate gas exchange between air and blood. D. To provide structural support to the trachea. Answer: C. To facilitate gas exchange between air and blood. This question tests understanding of the fundamental anatomy and physiology of the respiratory system. The alveoli are tiny air sacs in the lungs where oxygen from the inhaled air passes into the blood, and carbon dioxide from the blood passes into the air to be exhaled. This process is crucial for life. For instance, without healthy alveoli, the body wouldn't be able to get the oxygen it needs to function. Remember, the alveoli are the primary site where the vital exchange of gases takes place. Question 4. A dialysis technician notes that a patient's pulse oximetry reading is 88%. The patient is alert but reports feeling a little tired. What is the immediate priority action for the technician? A. Document the finding and continue monitoring. B. Notify the registered nurse immediately. C. Adjust the patient's dialysis prescription. D. Provide the patient with a warm blanket. Answer: B. Notify the registered nurse immediately. This question assesses the technician's ability to recognize a critical vital sign and prioritize action. A pulse oximetry reading of 88% indicates significant hypoxemia, low blood oxygen, which is a serious concern that requires prompt medical evaluation and intervention, even if the patient's symptoms seem mild. The registered nurse needs to assess the patient, potentially administer oxygen, and determine the cause. For example, waiting to notify the nurse could delay critical care, like applying supplemental oxygen, which is vital for preventing organ damage. Always remember that a low SpO2 reading is an urgent finding, and the RN is responsible for further assessment and orders. Question 5. Which of the following conditions is characterized by chronic inflammation, narrowing of the airways, and increased mucus production, often leading to difficulty breathing? A. Pneumonia. B. Pleural effusion. C. Chronic obstructive pulmonary disease, COD. D. Tuberculosis. Answer, C. Chronic obstructive pulmonary disease, COD. This question describes the classic symptoms of chronic obstructive pulmonary disease, COD, a common long-term respiratory condition. The keywords chronic inflammation, narrowing of the airways, and increased mucus production are hallmarks of COPD, which includes conditions like emphysema and chronic bronchitis. Unlike acute conditions, COPD causes persistent breathing difficulties that worsen over time, often from smoking. For example, a person with COPD might struggle with everyday activities because their lungs cannot efficiently move air in and out. Recognizing these key characteristics helps distinguish COPD from other respiratory illnesses. Question 6. What is the potential impact of fluid overload in a hemodialysis patient on their respiratory system? A. Increased vital capacity. B. Enhanced gas exchange. C. Pulmonary edema. D. Bronchial constriction. Answer, C. Pulmonary edema. This question directly links fluid management in dialysis to respiratory health. Fluid overload, a common complication for hemodialysis patients if they exceed their fluid restrictions between treatments, can lead to fluid accumulating in the lungs, a condition known as pulmonary edema. This makes breathing very difficult and impairs gas exchange. For instance, if a patient drinks too much fluid, their heart struggles to pump it, causing fluid to leak into the lung tissue. Understanding this connection is vital for patient education and recognizing respiratory distress in dialysis patients. Question 7. A patient with a history of COPD is receiving oxygen therapy at 2 liters per minute via nasal cannula. The technician observes the patient becoming lethargic and having shallow respirations. What should be the technician's initial action? A. Increase the oxygen flow rate to 4 liters per minute. B. Turn off the oxygen completely. C. Notify the registered nurse immediately. D. Encourage the patient to deep breathe and cough. Answer, C. Notify the registered nurse immediately. This question addresses a critical safety consideration for patients with COPD receiving oxygen. While oxygen is vital, for some COPD patients, excessive oxygen can suppress their respiratory drive, leading to respiratory depression. The keywords lethargic and shallow respirations indicate a potential problem. The technician's role is to recognize this change and alert the nurse, who can assess, make appropriate adjustments to the oxygen therapy, or initiate other interventions. For example, changing the oxygen flow without a doctor's order can be dangerous for a COPD patient. Always remember that changes in a patient's condition, especially related to oxygen, warrant immediate notification of the supervising nurse. Question 8. When assisting a patient with deep breathing and coughing exercises, what is the primary goal? A. To increase heart rate. B. To prevent muscle atrophy. C. To clear airways of secretions and improve lung expansion. D. To decrease blood pressure. Answer, C. to clear airways of secretions and improve lung expansion. This question is about the purpose of common respiratory therapeutic exercises. Deep breathing helps inflate the lungs fully, while coughing helps expel mucus and other secretions from the airways. These actions are crucial for preventing respiratory complications like pneumonia and atelectasis, collapsed lung tissue, especially after surgery or for patients with limited mobility. For example, encouraging a patient to deep breathe and cough helps prevent fluid or mucus from settling in the lungs, which can lead to infection. The main goal is always to maintain clear airways and promote optimal lung function. Question 9. Which breathing technique is often taught to patients with COPD to help them prolong exhalation and prevent air trapping? A. Kussmaul breathing. B. Cheyne-Stokes breathing. C. Pursed lip breathing. D. Biot's respiration. Answer: C. Pursed lip breathing. This question tests knowledge of specific breathing techniques beneficial for patients with chronic respiratory conditions, particularly COPD. Pursed lip breathing involves slowly exhaling through pursed lips, which helps to create a back pressure in the airways, keeping them open longer and allowing more trapped air to escape. This reduces air trapping, making breathing more efficient. For instance, if a patient with COPD feels short of breath, using pursed lip breathing can help them empty their lungs more completely and feel less breathless. It's a simple yet effective technique for improving ventilation. Question 10. A patient on dialysis complains of new-onset chest pain that worsens with deep inspiration. What might this symptom suggest? A. Myocardial infarction. B. Pleurisy. C. Gastroesophageal reflux disease, GERD. D. Anxiety attack. Answer: B. Pleurisy. This question focuses on interpreting specific chest pain characteristics. Pleurisy, also known as pleuritis, is an inflammation of the pleura, the membranes lining the lungs and chest cavity. A classic symptom is sharp, localized chest pain that intensifies with deep breathing, coughing, or sneezing. While other options can cause chest pain, the key clue here is the pain worsening with deep inspiration. For example, a patient might describe it as a stabbing pain when they take a deep breath. Recognizing this specific symptom can help alert the healthcare team to a potential inflammatory process in the lungs. Question 11. What is the correct way to assess a patient's respiratory rate? A. Count the number of breaths for 15 seconds and multiply by 4. B. Count the number of breaths for a full minute, observing inspirations and expirations. C. Estimate the rate based on the patient's skin color. D. Ask the patient how many breaths they take per minute. Answer: B. Count the number of breaths for a full minute, observing inspirations and expirations. This question ensures understanding of proper vital sign assessment. To get an accurate respiratory rate, it is crucial to count the number of full inspiration and expiration cycles for a full 60 seconds. This helps account for any irregularities or pauses in breathing, providing the most reliable measurement. For example, if you only count for a short period, you might miss an irregular breathing pattern. Observing respirations discreetly also prevents the patient from consciously altering their breathing pattern, ensuring a more accurate reading. Question 12. Which of the following is a common cause of respiratory acidosis in a patient on hemodialysis? A. Hyperventilation. B. Retained carbon dioxide due to hypoventilation. C. Excessive bicarbonate administration. D. Severe diarrhea. Answer: B. Retained carbon dioxide due to hypoventilation. This question connects respiratory physiology with acid-base balance, critical concept in dialysis. Respiratory acidosis occurs when the lungs cannot adequately remove carbon dioxide, CO2, leading to its buildup in the blood. CO2 combines with water to form carbonic acid, making the blood more acidic. Hypoventilation, or slow and shallow breathing, is the most common cause as it prevents CO2 from being effectively exhaled. For example, if a patient is sedated or has a severe lung condition, they might not breathe deeply enough to release CO2. Understanding this helps technicians recognize potential respiratory issues impacting overall patient health. Question 13. What is the primary purpose of a nebulizer treatment? A. To deliver large doses of oral medication quickly. B. To moisten and thin respiratory secretions for easier removal. C. To measure lung capacity. D. To induce a cough reflex. Answer: B. To moisten and thin respiratory secretions for easier removal. This question focuses on the purpose of a common respiratory treatment. Nebulizers turn liquid medication into a fine mist that can be inhaled directly into the lungs. This mist helps to moisten the airways, thin thick mucus, and deliver medications like bronchodilators to open the airways, making it easier for patients to breathe and clear secretions. For example, a patient with asthma might use a nebulizer to open their airways and reduce wheezing. It's an effective way to deliver medication and hydration directly to the respiratory tract. Question 14. When educating a dialysis patient about preventing respiratory infections, what is the most important instruction? A. Limit fluid intake to prevent pulmonary edema. B. Avoid all strenuous exercise. C. Practice good hand hygiene and get recommended vaccinations. D. Increase protein intake significantly. Answer: C. Practice good hand hygiene and get recommended vaccinations. This question emphasizes crucial infection control measures applicable to all patients, especially those who are immunocompromised like dialysis patients. Good hand hygiene, washing hands frequently, is the single most effective way to prevent the spread of infections, and recommended vaccinations, like flu and pneumonia shots, provide vital protection against common respiratory pathogens. While other options might relate to overall health, they are not the primary means of preventing respiratory infections. For example, consistently washing hands before eating or after coughing significantly reduces germ transmission. Always prioritize basic infection control practices for patient safety. Question 15. A patient undergoing hemodialysis develops sudden, severe shortness of breath, becomes cyanotic, and loses consciousness. The technician suspects an air embolism. What is the immediate priority action after calling for help? A. Administer oxygen via nasal cannula. B. Place the patient in Trendelenburg position on their left side. C. Increase the blood pump speed. D. Discontinue dialysis immediately and remove needles. Answer: B. Place the patient in Trendelenburg position on their left side. This question addresses a critical emergency scenario in dialysis, an air embolism. If air enters the bloodstream, it can travel to the heart and lungs, blocking blood flow. The immediate life-saving maneuver is to place the patient in the Trendelenburg position, head down, on their left side. This position helps trap the air in the apex of the right ventricle, preventing it from entering the pulmonary circulation and blocking blood flow to the lungs, allowing it to dissipate slowly. For instance, this specific positioning is designed to protect the patient's heart and lungs from the air bubble. While oxygen is important, positioning is the immediate critical step for an air embolism. Question 16. What sound would a technician most likely hear when auscultating the lungs of a patient with asthma during an acute exacerbation? A. crackles, rowels. B. Rhonchi. C. Wheezes. D. Pleural friction rub. Answer, C. Wheezes. This question tests the recognition of specific abnormal breath sounds associated with common respiratory conditions. Wheezes are high-pitched, whistling sounds, typically heard during exhalation, caused by narrowed airways due to bronchospasm, inflammation, or mucus. They are a classic sign of asthma exacerbation. For example, imagine air trying to pass through a very tight tube, creating that whistling sound. Recognizing wheezes helps identify patients experiencing airway constriction, like in an asthma attack. Question 17. The diaphragm plays a crucial role in respiration by A. Filtering air before it enters the lungs. B. Producing surfactant to keep alveoli open. C. Contracting and relaxing to facilitate inhalation and exhalation. D. Exchanging gases with the bloodstream. Answer, C. Contracting and relaxing to facilitate inhalation and exhalation. This question reviews the basic anatomy and physiology of breathing. The diaphragm is a large, dome-shaped muscle located at the base of the lungs. When it contracts, it flattens and moves downward, increasing the volume of the chest cavity and drawing air into the lungs, inhalation. When it relaxes, it moves upward, decreasing the chest volume and pushing air out, exhalation. For instance, without the diaphragm's movement, breathing would be very difficult and less efficient. It's the primary muscle of respiration. Question 18. What is the primary risk associated with prolonged immobility in relation to respiratory health? A. Increased metabolic rate. B. Development of atelectasis and pneumonia. C. Enhanced oxygen saturation. D. Decreased mucus production. Answer, B. Development of atelectasis and pneumonia. This question highlights a common complication for immobile patients. Prolonged immobility prevents full lung expansion and proper clearance of respiratory secretions. This can lead to atelectasis, collapse of lung tissue, and create a breeding ground for bacteria, increasing the risk of pneumonia. For example, a patient confined to bed might not take deep breaths, causing parts of their lungs to deflate and secretions to pool. Encouraging movement, deep breathing, and coughing is vital to prevent these complications. Question 19. A patient is observed to have very deep, rapid, and labored breathing. This pattern is commonly associated with diabetic ketoacidosis and is known as A. Cheyne-Stokes respiration. B. Kussmaul respiration. C. Biot's respiration. D. Apneustic breathing. Answer, B. Kussmaul respiration. This question tests knowledge of specific abnormal breathing patterns. Kussmaul respiration is characterized by deep, rapid, and often labored breathing, specifically a compensatory mechanism to expel excess carbon dioxide and reduce acidosis in the body, commonly seen in metabolic acidosis like diabetic ketoacidosis, DKA. The body is trying to blow off acid by increasing CO2 excretion. For example, imagine the body urgently trying to get rid of acid, resulting in these exaggerated breaths. Recognizing this pattern is crucial for identifying severe metabolic imbalances. Question 20. When educating a patient about the importance of regular exercise for respiratory health, what is a key benefit to emphasize? A. It significantly increases lung size. B. It improves the efficiency of oxygen use by the body. C. It prevents all respiratory infections. D. It reduces the need for vaccinations. Answer B. It improves the efficiency of oxygen use by the body. This question focuses on the benefits of exercise for the respiratory system. Regular exercise strengthens the respiratory muscles, improves cardiovascular fitness, and enhances the body's ability to extract and use oxygen more efficiently. While it doesn't dramatically increase lung size, it makes the existing lung capacity more effective. For example, a patient who exercises regularly will find it easier to perform daily activities without becoming breathless because their body uses oxygen better. Emphasizing improved efficiency can motivate patients to incorporate physical activity. Question 21. What is the normal range for respiratory rate in a healthy adult at rest? A. 4 to 8 breaths per minute. B. 12 to 20 breaths per minute. C. 25 to 30 breaths per minute. D. 30 to 40 breaths per minute. Answer B. 12 to 20 breaths per minute. This question assesses knowledge of normal vital signs. A respiratory rate between 12 and 20 breaths per minute is considered within the normal range for a healthy adult at rest. Deviations, either too slow, bradypnea, or too fast, tachypnea, can indicate underlying respiratory or metabolic issues. For example, a rate of 28 breaths per minute in a resting adult would be considered elevated and warrant further assessment. Knowing these normal ranges is fundamental for recognizing when a patient's condition might be changing. Question 22. Which gas is responsible for stimulating the primary respiratory drive in healthy individuals? A. Oxygen, O2. B. Nitrogen, N2. C. Carbon dioxide, CO2. D. Carbon monoxide, CO. Answer C. Carbon dioxide, CO2. This question addresses a core concept in respiratory physiology, the chemical control of breathing. In healthy individuals, the primary stimulus for breathing is the level of carbon dioxide, CO2, in the blood. When CO2 levels rise, the body's chemoreceptors detect the change and signal the brain to increase the rate and depth of breathing to expel the excess CO2. For instance, after holding your breath, the urge to breathe comes from the buildup of CO2, not the lack of oxygen. While oxygen levels also play a role, CO2 is the dominant driver for breathing in most people. Question 23. What is the purpose of using an incentive spirometer after surgery? A. To administer inhaled medications. B. To measure a patient's peak expiratory flow rate. C. To encourage deep breathing and prevent atelectasis. D. To assess the oxygen saturation level. Answer C. To encourage deep breathing and prevent atelectasis. This question focuses on the clinical application of a common respiratory device. An incentive spirometer is used to encourage patients to take slow, deep breaths, which helps to fully inflate the lungs and prevent the collapse of small airways, atelectasis, a common post-surgical complication. It provides visual feedback to the patient on their inspiratory effort. For example, a patient recovering from abdominal surgery might find deep breathing painful, but the spirometer helps guide them to achieve maximal lung expansion. This simple device is crucial for maintaining lung health during recovery. Question 24. What is a common sign of a serious allergic reaction, anaphylaxis, affecting the respiratory system? A. Unilateral facial drooping. B. Sudden onset of hives and swelling, followed by difficulty breathing or wheezing. C. Abdominal distension and constipation. D. Gradual onset of numbness and tingling in extremities. Answer B. Sudden onset of hives and swelling, followed by difficulty breathing or wheezing. This question tests recognition of a life-threatening respiratory emergency. Anaphylaxis is a severe, systemic allergic reaction that can rapidly impair breathing due to airway swelling, angioedema, and bronchospasm, leading to wheezing and severe shortness of breath. The sudden onset of skin reactions like hives and swelling, combined with respiratory distress, is a classic presentation. For example, if a patient accidentally receives a medication they are severely allergic to, these symptoms could appear quickly, requiring immediate intervention. Recognizing these signs is crucial for prompt action in an emergency. Question 25. Which of the following is the most effective way for a dialysis technician to identify a change in a patient's respiratory status? A. Reviewing the patient's medical history from the previous week. B. Relying solely on the patient's verbal complaints. C. Performing regular, systematic assessments, including vital signs and observing breathing patterns. D. Checking the dialysis machine's alarm history. Answer: C. Performing regular, systematic assessments, including vital signs and observing breathing patterns. This question emphasizes the importance of ongoing, thorough patient assessment. The most effective way to detect changes in a patient's respiratory status is through consistent, systematic assessment, which includes monitoring vital signs, respiratory rate, pulse oximetry, observing their breathing effort, symmetry of chest movement, and listening for any unusual sounds or reports from the patient. Relying on isolated pieces of information or infrequent checks can lead to missed cues. For example, regularly checking the patient's respiratory rate and watching their breathing can help catch early signs of distress before they become severe. Consistent observation is key to patient safety.